Alongside our models of care work, our work around primary care and community services sees our primary care colleagues as integral to our strategic planning. Through GP clusters, we're really starting to form and see how they inform the wider locality. We're looking to build early intervention around our practices, whether that be community connectors, pharmacists, optometrists, physiotherapists, right in there with our GPs at the front line. Our GPs in particular are really engaged. Our local medical committee come up with their own plan for future sustainability, and through engagement with them, and we have taken time out with all our colleagues and contractors to actually look at how we then take forward primary care and what we call our Ambitious for Ayrshire programme. Our model of delivery looks at delivery right there at multidisciplinary teams at the front line. There are different models of management depending on who's part of the multidisciplinary teams, including our GP clusters, and that feeds into our locality planning where our communities get a real say in what's happening. This is not about diluting professional skills, it's about bringing these together into multidisciplinary ways of working to better effect. I'm going to show an example from South Ayrshire with Dr AJ Costy, our Clinical Director for South Ayrshire, some of the work that we've been trying to do around anticipatory care planning.
What we've been thinking over the past year or two is how can we make this better? How can we spread this work in a way that everybody gets on board? And having done a few scoping events last year where we got grassroots workers coming together, talking about what ACP means, what is their contribution, and how can we put the patient at the centre and do things that improve their quality of life. We then came up with a plan to do a small pilot in one of the practices where we initially identify patients which will be suitable for anticipatory care planning.
What's key for me about anticipatory care planning is getting together with our social work colleagues, sharing essential information, but the key element is that face-to-face interaction. So we're no longer working in silos, we're working together in partnership and supporting people to live at home, to live healthier lives.
We usually arrange home visits and try and encourage family members who are carers to be there as well, so that we can look at the whole process for that patient and look at their needs and the carers' needs and see how we can further support them at home.
Ensure that the patient has the best, can use telehealth and resources around self-management, and ensure that they have their rescue medications and understand their medical needs, and can help them feel safe at home and remain at home and prevent hospital admission.
I think what the ACP meeting does allows us to tap into resources we are maybe not aware of, or even if we're aware of, how best to use them, where to contact them. And I think that's a resource that was, although in theory was open to us in the past, it was very hard to know where to turn. The ACP meeting, all the people around the table, and even if the person you want isn't there, the people who are around the table know how to access that person.
We feel that the anticipatory care planning project actually is at the heart of the integration agenda. We've talked for the past couple of years around wrapping services around GP practices and supporting primary care as well as other teams to deliver a better outcome, and we feel that this project is at the heart of this process. We will hope that going forward the key outcome of this project will be improved relationship and better understanding of each other's role, thereby contributing collectively to the 2020 vision that we're seeking.